Hi, my name is Dr. Kate Fadaka. I'm a child and adolescent psychiatrist. Today I'm going to be talking about anxiety disorder in children and adolescents. Anxiety is when it becomes a disorder, it's when it goes beyond the normal nervousness that we all get when we are facing new situations or having some worries about an upcoming event. That is normal. But when it becomes persistent and becomes debilitating in that it's affecting the day-to-day functioning of the child, it becomes a disorder. So anxiety disorder is a diagnosable mental health disorder. And it presents very differently from the way it presents in adults. In children, it manifests in, could be physical symptoms, it could be emotional or behavioral symptoms. The physical symptoms, when your child is complaining of stomach pain, feeling nauseous, and there's no physical cause for all those physical symptoms, shakiness, palpitations, where they are about getting into a situation that makes them anxious, and that happens consistently and affecting their ability to enjoy life, then those physical symptoms qualify as symptoms of anxiety disorder. Emotional difficulties are very common presentation of anxiety disorder in children. So they get very irritable, they have meltdown tantrums. The younger ones, they get very emotional, crying, and sometimes they throw themselves on the floor in the public, and that's just anxiety. And behavioral difficulties can be significant arguments in the family, friendship difficulties, you know, school refusal, which is a very common presentation of anxiety disorder in children and adolescents. And sometimes the symptoms of anxiety can be in the form of, poor sleep, poor attention, in class, poor concentration. And so sometimes people think it's ADHD and they pursue that diagnosis. Meanwhile, it's simply anxiety disorder the young person is experiencing. And there are different kinds of anxiety disorders. You have a generalized anxiety disorder where that young person is constantly on the edge. Everything makes them nervous. They are not able to go to see friends. They struggle to go to school. They struggle to go for outings with family. They worry about their health. They worry about family members. Just generally anxious about everything. And it's affecting their functioning, either socializing with friends, family, or even going to school. So that's generalized anxiety disorder. Then you have specific phobias where they're anxious about specific things. Some young people with actually what we call needle phobia. So when they're going to have their blood test for physical health, they get so anxious with the physical symptoms of shakiness, palpitations, and sometimes they faint. So those are specific phobias. Some people have specific phobia for certain animals. Some have uh, specific phobia about, worrying about vomiting in public. There are many sorts of specific phobias. Then you also have the social anxiety, which is quite prevalent in adolescent age group, where they get very anxious about how they will communicate with their peers, how they will respond to conversations, and that tends to affect their socializing, ability to make friends. And that's a core symptom in autism spectrum disorder. That's a significant anxiety they have comorbid with that disorder. Then you have the obsessive compulsive disorder. That's also a form of anxiety disorder where young people will develop, intrusive thoughts, about fear of something happening, something bad happening to their family members or themselves. And in a bid to manage that fear, they tend to carry out repetitive behaviors. So the common one is fear of contamination, and the compulsive behavior is hand washing. So they hand wash to the extent that their hands become very dry, requiring, sometimes bleeding from severe hand washing, and other times as well, they collude family members into their rituals, or else they will begin to have significant physical anxiety symptoms. So these are common, manifestation of anxiety disorder in children and adolescents. How do we diagnose this? It's not every child that is anxious that comes to see the doctor. There are many things parents can do initially to see if it helps. Parents can tend to understand their children, to uh, help them to learn the basic breathing uh, uh, exercises to be able to manage anxiety, deep breathing, reassurance, you know, getting to understand the reason for the anxiety. There are books as well, films that parents can get just to understand what anxiety is in their children and try to in the first instance, try to support them. Liaising with school as well, because common, outcome of anxiety in young people is not going to school. Making sure there are some adjustments made to make it easier for them to go into school and stay put in school through the lessons. And when all that is done and things are still not getting better, then it's time to seek professional help. And usually when young people with anxiety disorder come in to see a child and adolescent psychiatrist like myself, we would do a holistic assessment, looking at what the potential factors are, because the common potential factors are genetic factors. So do we have anxiety in the family? What precipitated the anxiety? Was there bullying? Was there any adverse experience that, the young person has experienced or the family has experienced? And what is maintaining it? And what are the factors, what support is the child having within the systems that will make him get better with treatment? So, within the context of assessment, we look at the factors that are, that precipitate anxiety disorder. And once we identify those and, we do a three-pronged approach, so usually psychological intervention is the first line recommended treatment for anxiety, and it's the modality of called cognitive behavioral therapy, CBT. It's the first line treatment for anxiety disorder in young people, and it actually works. CBT is, cognition. The C is for cognition, which means the thinking behind the anxiety. So what are the negative patterns of thinking that is maintaining this anxiety in this young person? So that bit is taken care of during the therapy sessions. The young person tends to learn how to change these patterns, replace them with more positive thinking patterns. Because the physiology behind anxiety is when you have negative thinking, your brain senses a threat and then it releases the fight-flight hormone, which makes you have the physical symptoms and makes you uncomfortable. So what the CBT does is helps you change that negative thinking pattern so that your brain doesn't sense like you're under a threat when you're facing that anxiety provoking situation. And thereby the hormones, the fight flight hormones are reduced. So you are better able to manage yourself in those situations. Unlike if you did not if you are not able to minimize the spiraling of those negative thoughts, it can get to the point where you get into a panic episode where you can't breathe. It's like you're having a heart attack. You're shaking all over. It's because the fight flight hormone has reached its maximum effect within the body system. And then you have the behavioral bit of the CBT as well, which is to manage the behaviors that reinforce the anxiety. So if you have anxiety about going to school, avoiding going to school and reinforces the anxiety. So what the CBT in the sessions that we do is to support you with how to change that behavior, even when it's hard, but baby steps, bit by bit, until you are able to go through to the being able to go to school, and where the anxiety work, what we call the behavioral experiments within the sessions are difficult, then the consideration of medication for anxiety comes in. And that's where we now sort of talk about the medications that we use to support young people as they're undergoing their therapeutic sessions for anxiety. The best outcome is combination therapy for severe anxiety disorder in young people. So the best outcome is psychological interventions and medication. And, usually we discuss the options with the families and decide which one the young person would go on. And while doing all that as well, you also have to look at the educational side of things. So reasonable adjustment within the school environment, supporting the young person to have like timeout cards so that when they are getting overwhelmed within the classroom system with anxiety, they can just go out of the classroom without causing much attention. Sometimes, schools offer flexible timetables. So maybe coming in a bit later than the start of school day, or coming in when the whole lots of young people have gotten into the class. We are not sort of seeing the crowd, which is a common reason for anxiety in some young people. And also sort of getting extra time to like do your work and submit. So sort of minimizing the pressure, within that environment. And most young people get better from anxiety disorder with the right support within the family as well, reassuring the young person, uh, it's kind of normalizing, kind of maintaining a calm environment within the household. Because it's common that most young people that have anxiety have a relative or a parent that has similar disorder. There's the concern that they feed into each other. So when the child is anxious, the parent doesn't know how to support the child, they get anxious as well. And that sort of perpetuates the child's anxiety. So we always say that parents that have similar disorder, it's helpful for them to get support from them for themselves while the young people are getting their treatment as well. That way, the perpetuating factor within the family setting, it's taken care of. And usually the medication for anxiety that we use what we call the SSRIs. And, we start low and we go slow. And usually young people tend to tolerate these medications. And like I said, you would have done some CBT work first. And if it appears that your symptoms are not getting better or they are too severe that CBT is not progressing, that is when we consider medication for anxiety. Lifestyle as well changes are also very important in managing anxiety disorder. A good routine. Every young person likes routine, especially the ones that are anxious. They feel reassured by routines. Good sleep. Having a good sleep hygiene helps the body to like completely recover by morning. So we encourage all that. Good diet is helpful for young people as well. Balanced diet. We encourage all that. And in a nutshell, that's basically a summary of, anxiety disorder in young people. Thank you.